We would like to welcome all of you to our webinar, 11 Minutes on Proton Therapy. My name is Ryan Perkins. I'm a board-certified radiation oncologist. I've been here several years, more than 25. My interests outside of radiation oncology include anything outdoors for the most part. I love kayaking, fishing, hiking, camping. My love is fishing. I spend most of my time with my children and 8 grandchildren. And speaking of fishing, whenever I go out fly fishing, one of my favorite things to do is to figure out what the fish are eating. Inside of my fly boxes, I have lots of different flies. And I'll have probably 25 to 50 different flies. The reason I do, and I won't use those every single day, is I don't want to have diversity. And as part of that diversity, it allows me to adjust to anything. What does that have to do with proton therapy? Most of your radiation oncology facilities have certain things that are available to treat cancers. The most common is a photon beam, which is an X-ray beam. If you look at the left part of your screen, this is a typical photon beam. That X-ray will go through, hit the tumor, but it keeps on going. As you can see, it exits out. And that's the most common type of a radiation beam. Most facilities also have an electron, which is a negatively charged particle for treating superficial cancers. The beauty of proton is it allows us to use a particle beam, and it will also allow us to treat into deeper tissues as well. The particle beam with proton, I can pretty much dial it in and go any distance that I want. If I want to treat to 7 centimeters, I can go down 7 centimeters. If I want to go down 10 centimeters, I can go down 10 centimeters. If you were to ask a radiation oncologist about what would be their perfect radiation beam, chances are they'll tell you and describe something that's exactly like a proton beam. So proton beam is one of the best forms of treating cancers. If you had a child who had a cancer that's a solid malignancy, chances are that child is going to end up getting proton beam therapy. Why? It works on the tumor and it spares normal tissue. Thus, you have a beam that is both effective and protective. There are lots of different types of cancers that can be treated with proton beam, as you can see: breast, lung, prostate, head and neck, brain, sarcomas, all the children's tumors, and many more will be coming up in the future as more research is done. There are no research papers or documents that show the proton beam is not effective on any cancer. Most of the studies are just to show that it is either equivalent or superior to standard types of therapy. When you look at proton beam, this slide actually shows some of the advantages of proton beam as it diminishes side effects to normal tissue. For example, in head and neck cancers, you'll have less opportunities and needs for using feeding tubes. You'll find out that in some cancers, there's improved survival. Down here, reduced risk of secondary cancers. If you look at lung cancers, there's going to be decreased lung complications associated with it. There will be decreased bowel complications as well. So there are lots of advantages for using proton beam as it spares normal tissue. As you look at this slide, I'm going to describe for you just a couple of patients where proton beam turned out to be the perfect thing for them. I have a gentleman who's in his mid-60s who has battled with Crohn's disease for most of his life. He's undergone several surgeries for his bowel. In fact, now he has a colostomy in place. He was diagnosed with prostate cancer after having an elevated PSA and biopsies. When he went to his urologist with the diagnosis of prostate cancer, his urologist said, "I really don't think that you're a good candidate to have an operation to remove the prostate because of all the previous surgeries that you've had. He said that he also didn't think that he would be a good candidate for cryotherapy, would not be a good candidate for HIFU, and said, why don't you go see if my radiation colleagues can give you a treatment option. When he met with the radiation oncologist, they basically told him, you're not a good candidate for a seed implant, and I really don't think that you're a good candidate for regular photon beam radiation. So here you have a man in his mid-60s with Crohn's disease, with a lethal cancer, and he has no treatment options available for him. What's he going to do? So he started to do research on his own, and then he met with another radiation oncologist who said, why don't you pursue proton beam? Perhaps that might be a good thing for you. When he met with us, it turns out that he's going to be a perfect candidate for proton beam. Why? As I mentioned before, it's effective and protective. We're going to be able to treat his prostate and not treat his bowel, where he's had so many problems in the past. So it turns out that proton beam is the perfect modality for treating him and curing him of his cancer. The second patient to talk about is breast. I have a young gal that was diagnosed with breast cancer in her early 40s. It was a left-sided breast cancer, and she elected to undergo bilateral mastectomies, followed by immediate reconstruction. She then received chemotherapy. Following that, she was looked at closely over the next 4 years. Unfortunately, after the 4th year, she was diagnosed with a recurrent left-sided breast cancer in the reconstructed breast. She underwent excision of the tumor. She underwent revision of the implant. And after that was done, they recommended that she now receive radiation therapy. Due to her physique, she's thin. She has rather large implants. Her lungs are well expanded, and unfortunately, her heart rests up high anteriorly against the chest wall. As you try to treat her with standard radiation therapy with photon beam, that beam will go through virtually 50% of her heart, and it will increase her risk of having a catastrophic cardiovascular event by 80 to 90% within the next 20 years. However, with proton beam therapy, due to its protective nature and our ability to minimize dose to lung and heart over standard radiation therapy, her risk of having heart disease goes down to less than 5%. So here's two great examples of where proton beam is far superior to standard radiation therapy. Now, you would think then that proton beam would be what everybody would want to do. We do have a lot of detractors against proton beam that we constantly have to battle. In my experience, the reason for the battle and the myths about proton beam, it's generated by people that believe that proton beam is going to affect their bottom line. The biggest detractors are radiation oncologists who say that it's not as good, it's not as effective. All of them have a vested interest not to have proton beam because it's going to affect the number of patients that walk through their door. The second is insurance companies. They don't want to pay for this. And so they will use words like that this is experimental, that this is investigational, which is not true. Proton beam therapy has been around for more than 35 years. It has a great track record. When you use proton beam, it allows us, as I said, to treat patients that have unusual diagnoses, also for people that have recurrent cancers that have no other options. Proton beams have been approved by the FDA since 2001. There are many, many studies that show the advantages of proton beam, of either its equivalence or superiority. If you look at journals such as New England Journal of Medicine, JAMA, Lancet, the Red Journal, the Green Journal, Oncology, all of them will talk about proton beam and its ability to treat patients effectively. Now, is proton beam expensive? Yes, it is, but all cancer treatments are expensive. When you look at regular radiation treatments compared to proton beam treatments, proton beam is about twice as expensive as regular radiation treatments, yet the machines that we employ to do this are between 10 and 30 times more expensive than a standard radiation therapy beam. Thus, it still is financially within the realm of almost all patients. Proton beam is covered by Medicare, Medicaid, and most insurance companies. There's no extra cost to the patient. We at the Ackerman Cancer Center have a great staff. It's not like insurance companies are lining patients to get proton beam therapy. We have to fight those insurance companies, but we know the type of documentation to provide to help patients get coverage, and we will be able to fight for patients' rights to get proton beam, and we're good at it. I hope that this has been helpful for you. If you have questions, you may submit those. We'll answer those offline. And we hope to continue these webinars in the future. The next one we hope to talk about is going to be the history of proton beam, which is a really fun discussion. And we hope to see you there.